Hi, my name is Cammie Evans. I am a radiation therapist and also a stress reduction coach. And I want to share a technique that may help you reduce some of the anxiety that you are feeling because you have to wear a mask for your radiation treatments. We are going to start by tapping on the side of the hand. And this is a really weird technique, and I know that it looks funny, it feels funny, and it seems impossible that this would help reduce some of your anxiety. But please stay with me. Please follow along, and please do the tapping with me so that you're not re-traumatizing yourself. We are going to state the truth of how we really feel. First of all, that gets the neurons in our brains firing, gets them lit up, and then we send this electrical signal through the tapping that helps calm that down so that we can reduce the fight or flight in your nervous system. So you can tap on either side, you can tap on both sides, one side, alternating at the same time. It's all good, whatever feels good to you. You can skip points if there's a point that hurts. Maybe it's really tender because you're receiving radiation. You can skip a point. I'm just going to go through the points because that's what I do, but you don't need to, especially if it hurts. Be kind to yourself as you go through this, but please, please stay with me to the end. So we're stating the truth of how we really feel. And number two, the reason that we state what we really feel is because it validates our experience. We are so quick to invalidate ourselves. So state the truth of how you really feel. I don't like this. I don't like this mask. And I'm simply acknowledging how I feel. Even though I really hate this mask, I've got to find a way through. Even though this experience is horrible, maybe this weird thing can help a little bit. So we're going to start tapping through the points, still stating the truth of what we feel. And eventually you will go positive, or at least have a little bit more compassion or choose to go through this, okay? But we're stating the truth of how we really feel. I can't emphasize that enough. I hate this mask. I hate this mask. And if you want to swear at that mask, you go right ahead. Add your own words. I hate this mask. And I'm emphatic on purpose. I hate this mask. I hate this mask. Tapping through the points. I hate this mask. I hate this mask. And nobody understands how awful this is. I hate this mask. You can stop tapping for a minute. The next thing we're going to focus on is what I hear my patients say a lot of times. I can't breathe. So we're going to start tapping again on the side of the hand. I can't breathe in this stupid mask. I can't breathe in this stupid mask. But I can breathe now. Or maybe I can't because my chest is too tight. And that's okay too. I can't breathe in this mask. I can't breathe. I can't breathe. I can't breathe. I can't breathe. And nobody understands how I feel. I can't breathe. And nobody gets it. I can't breathe. That mask is too tight. I can't breathe. It's too tight on my nose or my throat. I can't breathe. And they don't get it. Nobody understands how hard this is. Nobody understands how hard this is. That I can't breathe. Take a deep breath. You may need a sip of water to help keep that electrical signal flowing through your body as we turn down the fight or flight. The next topic that I want to introduce that we're going to do a round on is that mask. A lot of times it pinches in the nose, or maybe the ears get smashed, or the throat is really tight. Wherever that is for you, I want you to notice it. I want you to think about it as we tap on the side of the hand. Again, noticing the truth, acknowledging the truth of how we feel. Because a lot of times it's our emotions that amplify the stress that we feel on these different sensations. So by calming our emotions on this thing, or depending on your, if it's really tight on your lips or whatever it is, calming our emotions down may make it a little less uncomfortable. I'm not going to say it's comfortable because it's not, but maybe it can be a little more tolerable. So we're going to start again with the side of the hand. Even though this mask really pinches or hurts, I can see that maybe this is doing something to my anxiety as far as bringing it down. Even though this mask is really, really uncomfortable, I am open to thinking about it differently. Even though this mask is really, really uncomfortable. Right here, right now, I can breathe, and I can move, and I can have a choice. And I want you to think about where that mask is really hurting on you. Where is that mask really tight? I want you to picture your nose or picture your throat. Or maybe it's still trouble breathing. Maybe picture your lungs. Can you picture those lungs expanding, or are they still really tight? Whatever you are feeling is just fine. I just want you to close your eyes and picture it for a moment while we do the tapping. Picturing that on my nose or my chin where it's really tight, or my neck. Feeling that tightness now. And it makes me so claustrophobic. It's so tight. And I do want you to have your eyes open. Once you visualize that, I want you to have your eyes open. It helps your brain to know that you're not in that situation, so that your brain is receiving new information as we're seeing that stressful situation. calming down that fight or flight. As you think about that nose or that chin or that neck, feeling how tight that is on my body. Feeling how tight that and uncomfortable that is. I want you to stop tapping. And I want you to tune in. I want you to see, if you were at a 10 when we started as far as your anxiety level, what would that number be now? If a 0 is I'm just fine. What would your number be now? And there may be more to this claustrophobia, this mask that we can't address in a 10-minute video, but hopefully this takes the edge off a little bit. Now we are going to shift to something a little more positive or maybe just neutral, because it's really up to you to decide how you want to respond. You get to choose. Now that we have calmed down the fight or flight, you get to choose how you feel. So we go back to the side of the hand. Even though this mask still really is awful, I'm choosing to undergo this treatment to give me the best chance to beat this cancer. Even though this mask still is really awful. I'm open to looking at it in a new or different way. And you get to choose what that way is. Even though this whole situation really sucks. And I wish I didn't have to go through it. Maybe I can look at something positive. Maybe there's something good that has come out of this. And if you're not there yet, that is totally fine. We're just going to tap through the points. This stupid mask, does it have to frighten me the way that it has? Maybe this really weird technique helped. I do have a choice. I get to choose to wear the mask and receive the treatment. Or I get to choose not to. This mask is still stupid. These radiation treatments are still awful. But I'm open to a different perspective. I'm open to seeing this in a different way. Can I find anything good in this radiation treatment? And I'm giving you pause for you to see if there's something good. If there's one little itty bitty thing that you can be grateful for. This still sucks. This is awful. But I choose my response. I choose how to react. I hope that was helpful. I do have other videos if there's other topics, and I'm also open to suggestions if there's anything that you would like to learn more about or do more tapping on. Please reach out through my email or website at cammieevans.com. Thank you. I wish you all the best on your radiation treatment. Have a wonderful day.